Good afternoon. I know it was officially Groundhog Day earlier this week, and I know for Marion and myself and our teams and many others, it's felt like it's been Groundhog Day for a long time. Today, I will discuss COVID-19 and PEI in Canada, our vaccine distribution, the variants, as well as rotational and traveling workers and enforcement. Saturday marked the one-year anniversary of the World Health Organization declaring a novel coronavirus outbreak, a public health emergency of international concern. 1 year ago, there were 98 cases and no reported deaths in 18 countries outside of China. We have learned much about COVID-19 in the past year. The virus has moved around the world, disrupting how we live and interact with each other, and causing much economic and social disruption in 223 countries, including Canada. There have been almost 104 million cases of COVID-19 and over 2.2 million deaths. In PEI, there are no new cases of COVID-19 to report today. We currently have 2 active cases. Since the pandemic began, we've had 112 cases of COVID-19 with no hospitalizations or deaths. The situation in Canada continues to evolve with almost 32,000 new cases and 968 COVID-related deaths reported in the past week. The number of new cases is down 21% from the previous week. However, we are still well above the incidence reported at the peak of the first wave in the spring. The number of deaths in Canada increased by 3% in the past week, and ICU admissions were up slightly. On average, each day, 4,200 Canadians were in hospital with COVID-19, including 855 requiring intensive care. In the past week in Canada, we surpassed 20,000 COVID-related deaths in this country. Canada continues to struggle to get COVID-19 under control. I think it is too early to say we have turned the corner on the second wave of this pandemic. And of more concern now is the potential impact of the COVID-19 variant and its unknowns. We are learning the variants of concern are more easily transmitted from person to person, and certain variants may create more severe illness. The impact of the variants will be more fully understood in time. The entire world is learning about the mutations of COVID-19. There is concern that if variants get a sufficient foothold, they will overtake the original strain of the circulating virus. In other words, the variant strains could become the norm or predominant circulating strain. In PEI, all positive COVID-19 samples are sent to the National Laboratory in Winnipeg for sequencing. To date, we have not identified any variants of concern among our positive cases, but we will continue to monitor for variants with genetic sequencing. I share concern about the COVID-19 variants with my colleagues across the country. There is a real possibility that one or more variant strains of COVID-19 will have significant impact on Canadians, just as we are trying to get more people vaccinated. While the epidemiology of COVID-19 is different in PEI compared to other provinces, now more than ever, we must stick to our game plan of limiting importation of the virus into the province, and when we have cases, we must work hard to contain transmission. COVID-19 moves when we move. We will continue to manage our behaviors as we live with COVID-19, and we will strive to keep the virus out of our province and to limit spread. We know from our experience and that of our neighbors that adjusting our actions by following the basic public health measures is much easier and less disruptive than dealing with a large outbreak of this disease or a severe lockdown. Over the coming days, we will be reviewing the current isolation and testing processes for travelers and workers coming to PEI and islanders returning from travel. We will be adjusting requirements to further reduce the risk of importation of COVID-19. As I've said previously, we will not be out of the woods with this pandemic until at least 75 to 80% of islanders are vaccinated and we achieve herd immunity. We are still on track to have all our long-term care and community care residents and staff fully immunized by February 16th. And of course, Le Chez Nous residents and staff will get their second doses soon after this date. This week, public health staff are traveling to long-term care and community care facilities across PEI to administer the important second doses of COVID-19 vaccine. Last Tuesday, I indicated that as a result of production slowdown, we did not receive a shipment of Pfizer vaccine, that 975 doses. However, we did receive our regular Pfizer shipment yesterday, despite the snow. On Friday, we were advised that our next shipment of Moderna product will be reduced by 500 doses. But we have been advised that the disruption in the supply of Moderna vaccine is temporary, and that PEI, like other jurisdictions, will receive our full allocation of vaccine by the end of March. We are grateful that our plans to vaccinate all islanders by the fall is still on track. We recognize that our march towards immunizing all residents is slow and steady, and when we hit bumps in the road, we will need to keep going and we will need to adjust. As of Saturday, 7,856 doses of vaccine were administered, including 2,568 second doses. We are planning the next phase of our vaccine rollout for rotational workers, truck drivers, adults over the age of 80 living in the community, adults residing in congregate living settings such as residential homes, shelters, and group homes, and Indigenous adults living in communities, as well as starting partners in care. Registered rotational workers and truck drivers will be contacted directly by Health PEI with an appointment time to get vaccinated. Only rotational workers and truck drivers who are registered with our office will be contacted. Those who are not registered will receive their vaccine in a future phase. Any truck drivers or rotational workers who have not yet registered should do so immediately by going to the provincial website. Starting tomorrow, individuals age 80 and over will be able to make appointments to be vaccinated, and Marion will share details on how individuals age 80 and over can make an appointment. And subject to the availability of vaccine, these clinics will begin in late February. In the coming weeks, as we continue planning for future phases of the COVID-19 vaccine rollout, information will be available to islanders about how and when to book appointments. We ask for your patience and understanding, as it will take months to immunize all islanders, but there will be vaccine for everyone. We appreciate the support and leadership of Health PEI in offering immunization clinics across the province. And until everyone is immunized and we achieve herd immunity, we will continue to keep public health measures in place. We are still learning that even after receiving the second dose of vaccine, individuals may transmit COVID-19 to others in the absence of any symptoms. We will focus on immunizing as many people as we can, as fast as we can, based on our supply of vaccine. We will also continue with our basic measures, such as physical distancing, hand washing, wearing a mask in public places, keeping our circles small, avoiding non-essential travel, and staying home when sick. These basic measures are effective in containing transmission of COVID-19, including the variants of concern. As Dr. Tedros at the World Health Organization recently noted, while we may be tired of these public health measures, the virus is not growing tired of us. The federal government recently announced mandatory testing and a 3-day hotel quarantine period for all incoming air travelers to Canada. We understand there may be additional restrictions imposed for land travel in the weeks ahead. However, these details are not yet available. For international travelers returning to PEI after non-essential travel who test negative during their first 3 days in Canada, they will still be required to isolate in PEI for 14 days, and that will be at a hotel, and they will be tested regularly after arriving in this province. I urge islanders not to travel off-island unless it is absolutely necessary. Now is not the time to be traveling domestically or internationally unless it is for an urgent or necessary purpose. Our objective of keeping COVID-19 out of our province is more important than ever. We know that delaying the introduction of variants of concern directly affects how fast these variants take off when they are introduced. The longer we can delay the introduction of variants in PEI, the more time we have to get islanders immunized and protected against COVID-19. Managing through COVID-19 is a balance, especially in relation to islanders who need to travel for work and island businesses that require individuals to travel to PEI to do important work. We know that travelers coming to PEI increase the risk of importation of COVID-19. We attempt to limit this risk with testing and work isolation rules. Supporting the needs of individuals and businesses to travel safely in the midst of a global pandemic is a delicate balance. In fact, we've had a number of close calls whereby workers coming into our province tested positive for COVID-19 soon after arriving in PEI, and we have been very fortunate that to date none of these situations resulted in widespread transmission. I'd like to highlight a number of points. If you are a traveling or a rotational worker, please follow the rules for your specific situation, including the need to isolate away from others. These rules balance safety with the need for islanders to work, while allowing rotational workers the ability to spend time with their family when in PEI. Disregard of the rules puts island families and communities at risk. It is important that traveling and rotational workers follow the testing regimen. Testing at regular intervals is key in reducing the risk of transmission of COVID-19. If you are one of the small number of islanders approved for work isolation, if possible, I ask you to please wait for your first negative test before reporting to work. Currently, it is specified that individuals in high-risk work settings must wait for a negative test, such as childcare facilities, meatpacking plant, healthcare, fish plants, schools, or correctional facilities before going to work. However, if possible, everyone who is work isolating should wait for that first result before going to work. Effective immediately, incoming workers from Canada for less than 24 hours must be tested in PEI. If they are entering a workplace or a home or where there is any risk, they will be within 6 feet of anyone. As I noted earlier, rotational workers and truck drivers are required to register with our office. If these workers choose not to register, they are required to self-isolate for 14 days or for the duration of their time in PEI, whichever is shorter. Same-day travel self-isolation exemptions for islanders are intended for urgent and necessary situations, including work and medical care. Going forward, we will be reviewing requests for the same-day travel exemptions more closely with the aim of tightening up this area. Since the pandemic began, there have been 96 charges for failing to self-isolate or obstructing a public health official. 3 charges are pending. 765 random self-isolation checks have been completed since mid-December. We will be following up on rotational workers, truck drivers, and traveling workers to ensure they are following the testing regimen. Failure to be tested at specified intervals will have consequences, including a fine or revoking the rotational worker status, for example. COVID-19 continues to present challenges, with the variants being the latest threat. We need to be constantly on guard against this virus. This pandemic is not going to be with us forever, but we will have to continue to live with it for a while longer. We are all tired and yearn for life to get back to normal, and it is challenging for each of us to commit and recommit to doing our part to fight against COVID-19. Earlier this week, some members of my team commented, "I feel like we are starting all over again and we're back at the beginning." And I can understand that sentiment with the arrival of variants in the country and that we are in the early days of vaccine rollout and the unknowns about the long-term protection offered by vaccines. But we are not starting over again. We are in a much better position than we were in last March. We have learned from our experience and that of others. PEI is often compared to other islands around the world, including New Zealand. And like other islands, we have done well by controlling our borders and limiting importation of COVID-19 and thereby avoiding long and severe lockdowns. We have come this far, and we know what works against COVID-19. Let us stay the course and continue to follow the basic public health measures to protect ourselves and one another against this virus. As we continue our journey with COVID-19, I'd like to thank so many for your kindness and support, and let us all together continue to be patient and continue to be kind. Thank you. And I'll turn it over to Marion.
Thank you, Dr. Morrison. Good afternoon, everyone. Health PEI continues to work with the Chief Public Health Office as we plan to provide more vaccine to Islanders. Staff are prepared and ready to provide vaccines as soon as it's available. As Dr. Morrison mentioned, our long-term care and community care residents are in the process of receiving their second dose, and this is on track to be completed by mid-February, with the exception of Chez Nous, which will be the end of February. Vaccinations for certain congregate living groups, which will begin within the next few weeks as well, and these sites will be contacted directly to arrange for vaccinations. The community-based vaccine clinics will begin on PEI on the week of February 22nd for adults 80 years of age or older, our registered rotational workers and truck drivers, and the other groups identified by the Chief Public Health Office. For those individuals age 80 or older who live in our community and want to receive a vaccine, they can call a phone line tomorrow for booking appointments. The number to call is 1-844-975-3303. And this phone line will start to be able to receive calls tomorrow. The number is on the website, and I'll repeat it one more time for people. It's 1-844-975-3303. The line will be staffed 7 days a week, starting tomorrow from 8 a.m. until 4 p.m. And we're asking that only those individuals who are booking appointments for people 80 years of age or older call the line during those hours. Those over the age of 80 or 80 or over are asked to call the line, and while we know multiple people answering calls, depending on the volume, you may receive a busy signal in the first days. Please call back to book your appointment if this happens. Once you place a call and speak to someone, you will receive 2 appointments, both for your first and second dose of the vaccine. We're asking in advance for your patience, as Dr. Morrison does each week, as we know there are approximately 5,500 Islanders in this age category who've been awaiting their opportunity to receive the vaccine. The vaccine appointments will be booked over those coming weeks, the week of February 22nd and all through the month of March for these individuals. You will be offered an option in several locations for clinic appointments, and they will be spread across PEI. Clinics will be located in O'Leary, Summerside, Charlottetown, and Montague. We know there will be some Islanders, of those thousands that will be calling us, who are really anxious to get your appointment, but we are just getting started. Please be patient with us, and there will be a time between now and February 22nd to book your appointment. If you are an Islander who is 80 years of age and older and are unable to travel from your home to a clinic, you may still contact us through that phone line for an appointment. Our staff will work with you to arrange your vaccination dates. Islanders who are clients of Health PEI's home care services or who are awaiting placement in long-term care or community care facilities in this age category do not need to call for an appointment. These individuals will be contacted directly through our home care services. Registered rotational workers or truck drivers do not need to call as well, as they will be contacted directly through their registered as a rotational worker or truck driver, as Dr. Morrison mentioned, and we will make vaccine appointments with you for those clinics. I know Dr. Morrison spoke about our tiredness as we continue through this pandemic, but it is so important that everyone continue to follow the public health measures to keep the risk of COVID-19 spreading on PEI as low as possible. We also know the rollout of this vaccine will take months, so maintaining the good practices we have implemented to date to limit COVID-19 on PEI is so important. We continue to offer testing at our 5 locations across PEI, and we thank those Islanders who are being tested when they have any symptoms. Testing is such an important step, and anyone with symptoms is encouraged to receive a test. Our testing clinics did close early yesterday due to weather, but they're open on our normal schedule today. Our other healthcare services are able to continue, and we remind Islanders to seek care if you need it. If you're in need of emergency or urgent care, please go to an emergency department or call 911. A reminder again of our mental health and addiction services, which are available to you by visiting the bridgethegap.ca website for resources available on PEI, or you can also call the Mental Health and Addictions Information Line that is on the website. Calls on that line are answered by trained mental health and addictions staff and are available from 8 to 4 Monday to Friday. Just before I go, I will reiterate the phone number for those 80 years of age and older to book your appointments. It is on the website as well, but it's 1-844-975-3303. And I want to thank our public health nursing and in particular our clerical and support staff who will be manning the phone lines over the coming weeks to schedule these appointments. They've been essential to our rollout all along and through scheduling appointments in our COVID clinics and our cough and fever clinics, and we appreciate their efforts as we continue to move forward. Thank you.
Thank you, Marion. I'm just going to make a couple of remarks in French, translating some of what I said in English, and then we'll open it up for questions. À l'île du Prince-Édouard, il n'y a aucun nouveau cas de COVID-19 à signaler aujourd'hui. Nous avons actuellement 2 cas actifs. Et depuis le début de la pandémie, nous avons eu 112 cas de COVID-19 sans hospitalisation ni décès. À l'île du Prince-Édouard, tous les résultats positifs au COVID-19 sont envoyés au laboratoire national à Winnipeg pour séquençage. À ce jour, nous n'avons identifié aucune variante préoccupante parmi nos cas positifs. Nous continuerons de surveiller les variantes avec séquençage génétique. Nous continuons d'être en bonne voie en ce qui a trait à notre plan de vacciner complètement les résidents et les personnels des établissements de soins de longue durée et de soins communautaires et les travailleurs de première ligne qui participent aux interventions contre la COVID-19 d'ici le 16 février, sauf chez nous, qui est juste après ça. Vendredi, nous avons été informés que notre prochain envoi de produits Moderna sera réduit de 500 doses. Nous avons été informés que c'est temporaire et que l'île du Prince-Édouard, comme les autres juridictions, recevra notre allocation complète de vaccins d'ici la fin mars. Nos plans de vaccination de toutes les insulaires d'ici l'automne sont toujours en bonne voie. En date de samedi, le 30 janvier, 7 856 doses de vaccins ont été administrées. Nous planifions la prochaine phase de notre plan pour faciliter la vaccination des groupes clés suivants. Travailleurs par rotation inscrits, camionneurs inscrits, personnes âgées de plus de 80 ans qui habitent dans la communauté, les adultes résidant dans des lieux de vie collective tels que les maisons résidentielles, les refuges et les foyers de groupe, et les adultes autochtones vivant en communauté. À partir de demain, les personnes âgées de 80 ans et plus pourront prendre rendez-vous pour se faire vacciner. Sous réserve de la disponibilité du vaccin, ces cliniques commenceront à la fin de février. Nous demandons votre patience et votre compréhension car il faudra des mois pour vacciner tous les insulaires. Il y aura un vaccin pour tout le monde. Le gouvernement fédéral a récemment annoncé des tests obligatoires et une période de quarantaine hôtelière jusqu'à 3 jours pour tous les voyageurs aériens entrant au Canada. Pour les voyageurs internationaux qui retournent à l'île du Prince-Édouard après un voyage non essentiel dont le test est négatif pendant leurs 3 premiers jours au Canada, ils devront s'isoler quand même ici à l'île du Prince-Édouard dans un hôtel pendant 14 jours et subir des tests régulièrement après leur arrivée dans cette province. Cet isolement de l'hôtel sera peut-être à leurs frais. J'exhorte tous les insulaires à ne pas voyager hors de l'île à moins que cela ne soit nécessaire. Ce n'est pas le moment de voyager au pays ou à l'étranger à moins que ce ne soit dans un but d'urgence ou nécessaire. Merci. And I'll open it up for questions to either Marion or myself.
Héloïse Rodriguez, Radio-Canada.
Oui, bonjour. Docteur Morrison, j'aimerais vous entendre en français sur le genre d'impact que ça pourrait avoir à l'île du Prince-Édouard s'il y avait des cas de variants dans la communauté. On sait que c'est plus contagieux. À quel point ça serait dangereux dans un endroit comme l'île du Prince-Édouard?
Bonjour, merci pour la question. On sait avec ces variants, on voit que c'est plus contagieux et puis ça peut transmettre de personne à personne plus vite et plus facilement. Et ça nous inquiète en santé publique partout au pays. Et puis ici à l'île du Prince-Édouard, on a une capacité limitée vraiment au système de santé, au système de santé publique. Et puis, si on voit grand nombre de cas très vite et qui puis transmettre facilement entre les insulaires, juste en même temps qu'on est en train d'essayer de faire vacciner les gens qui sont plus à risque, serait vraiment terrible pour l'île d'expérience après tout ce qu'on a fait depuis longtemps. Alors, c'est pour cette raison qu'on parle de l'importance de limiter la possibilité de l'importation du COVID-19 ici à l'île.
Merci. Je peux poser une question de suivi?
Oui.
Oui. J'aimerais savoir juste par rapport à l'isolement maintenant, si quelqu'un arrive de l'extérieur du Canada et doit s'isoler 3 jours à l'hôtel, est-ce que après ça, ils doivent s'isoler un autre 14 jours à l'île du Prince-Édouard s'ils arrivent d'une autre des provinces? Et vous avez dit que ça va être peut-être à leurs frais, mais est-ce que ça va être effectivement à leurs frais? Peut-être me parler un peu de ça, si possible.
Oui, alors les insulaires qui ont voyagé pour raisons non essentielles, qui arrivent au pays, et à ce moment, ils doivent arriver à Montréal, Toronto, Calgary et puis Vancouver. Et puis, à leurs propres frais, ils doivent payer pour un hôtel jusqu'à 3 jours. Et puis avoir un test là-bas avant de continuer à l'île du Prince-Édouard. Et puis, mais quand ils arrivent ici, ils vont quand même doivent isoler pendant 14 jours de plus. Et puis, on ne veut pas qu'ils entrent avec... essayer d'isoler avec des autres personnes. On sait qu'il y a encore un risque de COVID-19. Et alors, on pense que ce n'est pas un grand nombre de personnes quand on regarde les nombres de chaque semaine, mais j'imagine qu'ils sont à un hôtel et puis on discute les détails et c'est peut-être qu'ils ont déjà payé pour leur hôtel pendant 3 jours, mais si on n'a pas une place vraiment toute seule pour isoler ici à l'île du Prince-Édouard, j'imagine qu'ils doivent avoir payé leur-même pour l'hôtel.
Merci.
Okay.
Stephanie Kelly, CBC.
Good afternoon. I have a question for Dr. Morrison. We're hearing from some tourism operators that are struggling to plan just because there's so much uncertainty, obviously, about the summer. Just wondering if you had a message for them at this point, what would it be?
Well, I certainly can understand that struggle that they're having as they look ahead, and I wish we all had that we had a crystal ball to look into and say for sure what it would be like. I think a lot of it will depend on how many people can be vaccinated, not only here in Prince Edward Island, but around the country by the summertime. And so that will depend on vaccine supply. It will also depend on what we learn about the effectiveness and asymptomatic transmission related to the vaccine. I think it will also depend very much on our public health measures and the variant that we're going to see within the next 2 months. So I think it's hard to look ahead to the summer, but I understand why the tourist operators would be struggling, and I feel some of that same struggle as we look ahead. But for right now, the little part that we can look ahead is that we need to try to see this virus get well contained in this country, limit the importation here as we get people vaccinated, and as we learn more, we'll be certainly having those ongoing conversations with tourism.
Okay. And a follow-up to that, just wondering if there is any planning happening right now for whenever travel does resume, whenever that might be, on what that will look like in terms of checkpoints coming into PEI or possibly pre-approval?
Yeah, so at this point in time, we, as we've mentioned, the pre-approval travel for the various streams into the province and border screening would be in place for certainly the next months as we look ahead. And I think we can and we know we've seen that change over time, when the Atlantic bubble was in place, and then hoping that we can also get back to that point where we have the Atlantic bubble. And but even with the Atlantic bubble, we still had pre-approval travel for those outside the Atlantic bubble and border screening. So I certainly, when we look ahead, that will be in place for the foreseeable future.
Okay, I promise this isn't a third question. I'm trying to sneak in. My colleagues tell me that in French you mentioned something about the potential impact of the variant. I was just wondering if you could say that in English.
Yes, and I'm glad you asked. We're talking about the variants and that we look at how much more easily it appears to transmit from person to person, and also the speed of transmission. It's even seeming to spread more quickly. And as we learn more about that, that is of big concern for my colleagues across the country. And the impact on Prince Edward Island, if we had a lot of transmission, quick transmission in our province with, we've talked right along, we have a certain public health capacity, a certain health system capacity, and with large numbers of cases really quickly that we couldn't manage well, that would be a grave concern here. And we've seen some of the impacts of this third variant, or the variant, in other parts of the country and the world. And some indication that if we do not manage this variant and the introduction of variant into this country really well, then it would potentially mean a third wave of COVID-19 in this country in 2021. So it is a concern for the whole country, but also for us here in Prince Edward Island.
Thank you so much for your time.
You're welcome.
Gabrielle Drummond, Radio-Canada.
Bonjour, Dr. Morrison. Une question en français. Donc, vous avez parlé à ma collègue sur les voyageurs qui proviennent de l'international, de l'extérieur du Canada, qui vont devoir s'isoler pendant 14 jours et qui vont rester à l'hôtel pendant un certain temps et après, ils vont devoir se faire tester. Alors, est-ce que vous pouvez nous donner plus de détails? Combien d'établissements hôteliers, combien d'hôtels seront à la disposition de ces voyageurs-là? Et est-ce que la santé publique va offrir du soutien à ces personnes qui vont devoir rester dans un hôtel pendant un certain temps?
Je pense que c'est peut-être important on est déjà, on a d'expérience à voir les gens dans les hôtels ici à l'île du Prince-Édouard. On a les gens qui travaillent temporary foreign workers, j'oublie comment dire ça en français, les étudiants qui viennent en septembre et encore en décembre, janvier, d'ailleurs, dehors du pays. Et puis, on a moins de ces étudiants maintenant. On a regardé, et pour les raisons non essentielles, on avait seulement, je pense, 3 voyageurs d'étrangers hors du Canada qui viennent d'arriver dans la les 2 semaines qui sont passées. Alors, les nombres ne sont pas grands. On a des hôtels on vient d'utiliser pour les étudiants et les autres gens. Et des fois, on a des cas où les personnes qui ne peuvent pas isoler avec leur famille, ne veulent pas isoler avec leur famille parce qu'ils sont les contacts des cas. On offre les hôtels aussi pour ces gens. Alors, on a des possibilités d'expérience avec les hôtels, mais pour cet groupe, on ne pense pas que le nombre, c'est très grand.
OK. Et ma deuxième question, c'est toujours par rapport au voyage. Alors, les exemptions des permissions de voyage, vous avez mentionné que ça sera réévalué. Donc, vous ne conseillez pas les personnes à quitter l'île, bien évidemment, mais on sait qu'il y a les travailleurs essentiels qui doivent quitter, sortir de la Provence et après revenir. Alors, de quelle façon cette situation-ci, ces nouvelles règles, vont exercer un certain impact sur ces travailleurs essentiels, les travailleurs rotationnels qui doivent voyager à l'extérieur de l'île?
Alors, ça va pas avoir l'impact sur les voyageurs, les rotational workers, les travailleurs rotationnels où il faut aller hors de l'île pour travailler parce qu'ils ont déjà fait l'application pour en faire. Et puis, ils ont... alors, on a une méthode de les suivre pour s'assurer qu'ils sont testés. J'ai parlé vraiment de les personnes qui travaillent juste, ou peut-être ils vont aller à Moncton pour une visite médicale. Alors, ils doivent en aller. Et puis, ça, c'est une raison essentielle. Et puis, il revient ici. C'est la même journée. Alors, mais on ne veut pas que les personnes vont pour faire le shopping quelque part. Et puis, d'aller-retour même journée. Et puis, alors, on va essayer de s'assurer qu'ils n'ont pas les autres sortes de visites. C'est vraiment pour travailler, pour les raisons médicales ou pour compassion aussi.
OK, parfait. Merci. Bonne journée.
Bonne journée.
Wayne Thibodeau, CBC.
Good afternoon, Dr. Morrison. I just wanted to pick up on a comment that you had mentioned during your briefing. You had said in the coming days that you will be reviewing the isolation requirements and adjusting them to limit the importation of COVID-19. Can you expand upon that a bit and tell us what changes are being considered?
Hi, Wayne. I think certainly, and you'll have maybe heard mention of this in other parts of the country as well, that we have, for instance, had isolation plans submitted where, and have approved isolation plans where people may have, say they're in different parts of a house but sharing a kitchen, but they... and maybe if they, but we always wanted people to have separate washrooms, but they're still in the same house. And some of the other provinces as well, looking at making sure that people, if they need to isolate, they cannot do that in the same dwelling as someone else. Maybe if there's a separate entrance, a separate apartment, or an access to the basement that isn't shared. So those kinds of things, we need to be looking at those, for instance. What does that look like? Because we know the transmissibility of this variant, if people go into isolation, can happen quickly. It doesn't have to take very long. And we really want to make sure that people are truly isolating. So that would be one of the things that we are looking at, and what that means for other people isolating in the house with them.
And if I could also follow up with regards to the 24-hour exemptions, I know you mentioned that you're looking at tightening up there as well. Have you seen some issues? Could you give us some examples? Are people taking advantage of the 24-hour exemptions?
Well, speaking to the folks at the border who are managing the border, they are spending time every day having to review and manage some of the same-day exemptions. And they are sometimes being told, well, they bought something on Kijiji and they need to go and pick it up, or they need to go get hockey pants, whatever the case may be. And I think we need to look at, we have more cases. We know that New Brunswick has had a number of cases and a larger number of active cases than they would like. They announced yesterday, I believe, that they have had cases of variants in their province. And so we want to limit that risk of importation here. So we recognize that we do really need to have our workers go back and forth, and people need to get to medical appointments, and for compassionate reasons, they may need to get back and forth. But if there are alternatives to getting products picked up, and do they really need to go right now? This would not be the time to go. So it's those kinds of things, Wayne, we are really wanting to look at, given what is going on in our neighboring province, but also right across the country with the concern around the variant.
Thank you very much for your time.
You're welcome.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'ai une question sur un sujet, je crois que vous n'en avez pas parlé. C'est la bulle atlantique. Est-ce que vous êtes confiante aujourd'hui pour la date du 15 février ou pour le moment, il ne faut pas compter sur cette date encore?
Bonjour Laurent. Je sais que la décision à propos de la bulle atlantique est vraiment dépendant ce qui arrive autour de nous et l'épidémiologie au Nouveau-Brunswick, la Nouvelle-Écosse. Alors, à ce moment, je pense que mi-février est un peu tôt, mais je sais que c'est quelque chose que j'aimerais en avoir, et puis je sais que le premier ministre aussi aimerait en avoir à un moment donné. Mais on va voir. Je ne viens pas de discuter une date exacte, mais je sais que ces discussions vont toujours être là, et puis on va en discuter encore.
Merci. Et j'avais moi aussi une question sur les voyages internationaux. Vous en avez déjà beaucoup parlé. J'aurais juste aimé savoir comment la décision a été prise, puisque le gouvernement fédéral a décidé d'imposer 3 jours à l'hôtel. Nous, à l'île du Prince-Édouard, il y a déjà les 14 jours qui sont déjà très bien contrôlés. Donc j'aimerais savoir s'il y a eu des discussions à ce sujet avec le gouvernement fédéral, et pourquoi vous décidez de continuer à avoir 14 jours ici et pas 11, par exemple.
Bonjour, la décision n'était pas discutée avec nous. C'est, comme vous avez dit, c'est quelque chose qu'on vient de faire depuis les mois ici à l'île du Prince-Édouard. On mis les personnes qui viennent des voyages hors du Canada, et puis en isolement pour 14 jours, et on fait des tests. Alors, pour ça, c'était ce qu'on faisait depuis les mois. Mais pour le gouvernement fédéral, c'était quelque chose qu'il vient d'en faire plus récemment. Et ils ont mis 3 jours parce qu'il va avoir le premier test. Alors, je pense que ça va prendre un bout de temps de faire les tests à les 4 locations, Montréal, Toronto, Calgary, Vancouver. Mais pour nous, si le voyage, s'il y a un test négatif à Toronto, il doit mettre en avion encore une fois pour venir ici. Alors, ils sont exposés à un risque encore. Alors, pour nous, on va commencer encore le 14 jours, et puis on va faire les tests. Et c'est ce qu'on parle à ce moment. Et puis, alors, c'est pour n'importe qui vraiment qui vient d'Ontario, même sorte de choses. C'est hors du pays, c'est même 14 jours.
Merci.
I just might, I know that I will be asked something in English. It was around the decision about the federal decision around having people returning from non-essential travel outside the country to have to stay up to 3 days in one of the 4 locations when they arrive by air. And that's really to allow the time for those tests to occur. And we have decided that we would want people to come and actually isolate here for 14 days because, for instance, even if they test negative in Toronto and then get on a plane to come from Toronto to Charlottetown, there may be more exposure again before they get here to other people, and we would treat them like we would for anyone else coming from Ontario in that case, but anyone who's arriving from outside of the island that he would have to isolate for 14 days.
Stu Neepy, The Guardian.
Good afternoon. A question to start for Dr. Morrison. You mentioned about being more prepared, this time compared to last March. Likely there are people who might have set down some plans to travel in March for the March break period. I'm wondering what your advice is to people, islanders, considering either international or domestic travel around the March break period.
Well, I think very much in keeping with national recommendations that they should avoid travel outside the country and non-essential travel outside the country. And domestically, you're hearing the same kind of message, avoiding travel outside people's own provinces wherever possible. And they will anyone who does travel outside the country, I think it's been very clear that there'll be limited flights to certain locations, and when they come back, they will need to land in one of the 4 airports and then isolate at their own expense for up to 3 days, and then when they return to Prince Edward Island, it will be another 14 days of isolation. And at this point in time, I know people are getting anxious to move and to travel off island as we go into these winter months. But I think at this point in time, it's hard to look too far ahead. But it's I would not be booking a flight off island right now or for the March break.
Okay, thanks for that. And I guess next question, I suppose, could be addressed from either Ms. Dowling or Dr. Morrison. Just about rapid testing. Now, you had spoken to a standing committee back in January saying that I suppose CBHO staff don't really consider rapid tests to be as sensitive as PCR tests. But the federal government has shipped about 38,000 rapid tests to PEI. So I guess I'm wondering if there is any consideration of using those rapid tests in the future, and if not, then why receive that shipment from the federal government?
Yes, so Stu, we actually were updated yesterday on some of the rapid testings as part of a national discussion, and so we are absolutely looking at where and how those rapid tests could be used most appropriately in Prince Edward Island, and so those conversations are very active, and we'll let you know as soon as we can make an announcement where they can be used most appropriately. One of the advantages that we've had here, that we've had testing capacity and PCR testing capacity, which is certainly the preference. But if we can use these rapid tests in certain settings where they're appropriate and give us give us some kind of assurances in certain cases, even as one additional measure. We're absolutely looking at that, and we'll be having that conversation again, especially in light of some of the new information on the rapid tests. I think it's even later this afternoon, so we'll let you know as those conversations continue.
Okay. Thank you very much.
Okay, thank you all. Have a nice afternoon.